Cannabis, miracle plant or dangerous drug? For centuries, cannabis has been used by different cultures for medicinal, recreational, and even spiritual purposes. Yet, in modern times, it has become one of the most debated substances in the world. Some claim it's a harmless natural remedy, capable of relieving pain, reducing stress, and even treating serious illnesses. Others warn that its effects on the brain and body can be harmful, addictive, and even dangerous. Cannabis contains over 100 different compounds, but the two most well-known are THC, tetrahydrocannabinol, and CBD, cannabidiol. These chemicals interact with the body's endocannabinoid system, a network of receptors that helps regulate pain, mood, sleep, and appetite. Pain relief and inflammation. Studies have shown that cannabis can be effective in reducing chronic pain, especially for conditions like arthritis, multiple sclerosis, and nerve damage. Many patients report that it provides relief where traditional painkillers fail. Anxiety and mental health. CBD, a non-psychoactive compound in cannabis, has been found to reduce anxiety, stress, and even symptoms of PTSD. Some research suggests that small, controlled doses of THC may also have relaxing effects. Seizures and epilepsy. In some cases, cannabis-based medicines have been life-changing. Epidiolex, a cannabis-derived medication, has been approved by the FDA to treat severe forms of epilepsy in children, drastically reducing seizures. Cancer treatment support. Cannabis is sometimes prescribed to cancer patients undergoing chemotherapy to reduce nausea, vomiting, and appetite loss. Some studies even suggest that certain compounds in cannabis may help slow the growth of cancer cells. Legalization and medical use. Across the world, more and more countries are legalizing cannabis for medical and recreational use. Canada, Uruguay, Germany, and many U.S. states now allow it, opening the door for new research and applications. The risks and side effects of cannabis. While cannabis has clear medical benefits, it also has potential downsides that shouldn't be ignored. High THC levels and mental health. Modern cannabis is far stronger than it used to be. In the 1960s and 70s, cannabis contained around 3 to 5% THC. Today, some strains exceed 30% THC, increasing the risk of negative mental health effects. High doses of THC can cause paranoia, hallucinations, and increased anxiety in some users. Memory and cognitive impact. Regular cannabis use, especially at a young age, can affect memory, learning ability, and motivation. Studies suggest that heavy cannabis use before the brain fully develops, around age 25, may lead to long-term cognitive impairments. Addiction and dependence. While cannabis is not as addictive as nicotine or alcohol, it can lead to dependence. Studies show that 9 to 10% of users develop cannabis use disorder, CUD, meaning they struggle to quit despite negative effects. Impaired driving and reaction time. Cannabis affects motor skills, coordination, and reaction time, making it dangerous to drive under its influence. Research suggests that driving high doubles the risk of accidents. Lung health. While cannabis smoke contains fewer carcinogens than tobacco, inhaling any type of smoke is not good for lung health. Long-term cannabis smoking can lead to chronic cough, lung irritation, and bronchitis. The importance of responsible use. Like any substance, the key to safe cannabis use is moderation, knowledge, and responsibility. Dosage matters. Small doses may help with relaxation and pain relief, but high doses can lead to unwanted side effects. Know your strains. Some cannabis strains contain more CBD, which helps counteract THC's psychoactive effects. Understanding the balance between CBD and THC can help prevent anxiety and paranoia.